Hi, this is Dr. David, physical therapist, owner of Paso Manual Physical Therapy, and I'm answering the question of what to expect when you go to your first physical therapy appointment. So as you can see here, this is my office. I've got the charts on the wall. I've got a little treatment table here. That's my workstation back there where I'll type out any notes and communication stuff I need to do. This is what it looks like. I'm inside of a gym. I'm gonna just turn the camera around so you could see everything here. And there's weight equipment there. There's the entrance there to this area here. Some free weights. And this is part of a bigger CrossFit gym. Let me show you the rest of the gym here. Just to take a peek. There's the rest of the gym. They just finished a class. So there was music blaring. So you might hear music blaring here inside the gym when you come, especially if you come during peak hours, you know, after 4 o'clock and early morning, that kind of thing. And what will happen on your first visit is we'll do a thorough assessment. We're going to be checking joints specifically, muscles, nerves, individual joints, like we'll check a certain level of your neck or your back, depending on where the issue is. Or, you know, if we're talking about a wrist, hand, or an ankle and foot, we'll check each individual bone inside there and how it's moving relative to the next. And then we'll check muscles in the area and see if there's any muscle imbalances. A muscle imbalance, in short, is just when, you know, in every part of the body, there's 4 or 5 muscles that accomplish a movement. So a simple example is when you bend your elbow like this, everybody thinks of the bicep as being the main muscle that does that, and it is, but there's also the brachioradialis. It's another muscle that's right here. There's the brachialis muscle, which is a muscle under the bicep. So there's a few there. It gets a little more complicated when we're talking about the spine, like the neck and the back. Every motion that you do is controlled by several different muscles. So we have to tease out each muscle and see which one is maybe not working hard enough or working too hard, and that could be causing the tightness or the pain. And then we also look at nerves, and we have specific tests where we can tension out nerves and isolate which nerve is causing the problem. And sometimes there's overlap as far as it might be a joint with a nerve or a muscle with a nerve or a joint with a muscle. And then from there we can definitively tell you what exactly to do from there. And then we can also tell you how long it should take you to recover, as far as, you know, it might take a month or 6 months or a year. If it's a disc problem, it can take likely a year. But we have to, you know, do a thorough assessment. The assessment can take anywhere from 30 minutes to 60 minutes, just depending on how many body parts are involved, how deep we have to dig, how much history we have to pull out. You would have already gotten an online intake form, a health history form, and that helps to save a lot of time, so be sure to complete that before your visit. That way we're not spending time having you complete the form here, or me having to pull out the questions from you. I can already have reviewed it, and then we're ready to go and start doing the assessment portion. And then as long as we have time, which we usually do, we'll do some treatments. So you might get 1 or 2 hands-on techniques, and also you get an exercise or 2 to take home and start working on. The exercises are critical. That's what's going to make you better by far the quickest and long term. It's going to give you the long-term solution. The stuff I do with my hands here in the clinic is just boosting the care for the short term, boosting the recovery and the pain reduction for the short term. The stuff you do on your own that I'll guide you on, that's what's going to really cure your problem and make sure that it's not coming back in the long term. So be prepared to do those exercises once you get them. And I'll provide you with a video, more than likely, if it's a common exercise that I have. We can even shoot a video here on your phone, or I can shoot it on my phone, and that way you have a reference as to what to do and exactly how to do it. And then you're always welcome to call me, text me, email me any questions you have. I have patients that go do their exercises, and then sometimes they'll start getting we'll need to make some modification or tweak on their exercise, and so we can do that over phone if it's going to be a long time between now and our next visit. So that's what you can expect for your first visit. Subsequent visits after the first, you tend to go a little bit faster because we're not doing evaluation. It'll be just the hands-on part and then education about how to do the exercises, any modifications or progressions. You know, if you've been doing your exercises, likely I'll need to progress you. I'll need to make it a little bit more challenging and harder so that you can get stronger in those muscles that are weak and get to feeling better faster. So I look forward to seeing you in the clinic real soon. Thanks and have a great day.